Hello, I'm Dr. April Oliver with today's Vision in Tomball. Today we will be discussing common vision issues that cause children to have a hard time reading and keeping up in school. Let me ask you a question. Has your child been recently diagnosed with dyslexia, ADD, or Irlen syndrome? Have they been sent for special testing or been given a color filter to put over their work? Do they have trouble reading for long amounts of time and seem disinterested in learning? There are many different issues that can cause similar symptoms. Sometimes it is difficult to discriminate between the two. Even though a child may pass a vision screening and has, quote, 20/20 vision, does not mean that there's not an underlying vision issue. Some children are not nearsighted, farsighted, or have astigmatism, and they technically do not need glasses. However, they still have trouble reading for long amounts of time comfortably. Sometimes children have underlying vision issues that go undetected, and these issues are actually much more common than you would think. Sometimes they have a slight muscle imbalance, or their focusing muscles are not quite as strong as what is considered normal. One common disorder that I see quite often is called accommodative insufficiency. Basically, this means that the focusing muscles inside the eyes get tired easily and fatigue. It can affect children, teens, and adults. Many times with this condition, the patient will complain that when they are looking up close for long amounts of time and then look across the room, things are blurry and they have to blink to make them go back to normal. They also notice that symptoms get worse as the day goes on, and they may eventually get headaches, eye strain, and words on the page may get blurry, or they may lose their place when reading. Like many muscles in the body, we are able to strengthen and train these muscles by doing simple eye exercises that are known as vision therapy. Vision therapy can be done at home or in the office. One of the easiest and most effective methods is to install the program on a computer at home. It can then link to my computer in the office, and I can watch their progress remotely and adjust accordingly by altering the program as needed. I will then see them back periodically for follow-ups to measure their progress and see how we should proceed. This therapy can last as little as 2 or 3 months, or it can go longer. It is strictly on a case-by-case basis, and it depends on how severe it is. Kids typically do the exercises for 5 minutes a day, 5 days a week. Other common disorders that I see often are something called convergence insufficiency. This means that the eyes have a hard time turning inwards when reading, and they have a hard time maintaining that position. A lot of times the kids will complain that the words move around on the page and that they see double vision. We can treat this issue with different methods, such as special glasses that have something called prism in them that helps to allow the eyes to see comfortably in resting position. Or we can also do vision therapy exercises as previously discussed. There are several other issues that can cause similar symptoms, such as lazy eye, or the technical terms for this are amblyopia or strabismus. Amblyopia means that the eye is functionally normal, but for one reason or another it does not see as clearly through the glasses. And strabismus means that the eyes are not perfectly straight in resting position, and that one eye will deviate in or possibly even up or down. As you can already tell, our eyes are quite complex, and there is a lot that goes into seeing clearly that goes beyond just glasses and contact lenses. The only way to really know if your child has an underlying vision issue is to do a thorough eye exam that involves a sensory motor test. Most of the time, this exam is covered by insurance. So if you're worried about your child or yourself, or having trouble reading comfortably or focusing, then please come and see me so that I can determine if it is a vision-related issue and if there is a simple solution to help improve the symptoms. Thank you for joining me today. I hope to see you soon.